So we're removing the nasal splint for this gentleman. We've done rhinoplasty for him. We also did hair transplantation. You can see that we've got the lower hairline a little bit more lower. So that's something we did a couple of days, 3 days before we did the rhinoplasty. And now you can show the before while I. So he wanted us to improve the dorsum. Sorry about that. I just done. You can see. 1 second. Just. I think it's beautiful. Come, have a look. So what do you think? It's nice? Yeah, it's actually quite nice. See, because you had very, very thick nasal skin, in spite of that, we've been able to give you a pretty nice proportion. You remember I told you we need to lengthen your nose? See the length now. Now you see in the mirror, you can see both. Now you see the difference. Right? Then you remember I told you this area is depressed. Now this is little extra. The way it looks now, it's going to come down when the swelling comes down. Okay? Then the tip. See the tip. I won't say it's very pointy, but it's going to be more proportional and much more harmonious to your face. Okay? Look at the side view. I think that's the key. That's really beautiful. The other view. Look at that. Now you have a really nice long straight dorsum, a good tip. This length is increased. We've narrowed it down, and then there's a nice dorsal aesthetic line. The width of the nose has come down. You can see here how it was. It was undulating and not like really prominent. Yeah. How's your breathing? You're okay? Much. Okay. It'll take some time. Just 1 week, you'll become alright. How's your rib pain? Bearable. But how was it one day after surgery? Like severe?
1 day after surgery, it's not severe. I don't say it's severe.
But it was more than now?
More than now.
Cool. Yeah, that's nice to know that your pain was not too much. And you have to take good care of your nose. You're traveling back today?
Today.
Cool. So make sure that you take good care, take our precautions. We'll give you a contact number, WhatsApp contact number after surgery. So many patients, even after I say this, go on contacting us on the previous WhatsApp numbers. Then that becomes messy. Because see, this number is given dedicatedly for patients who've had their treatment here. And that is handled with a doctor. So if you have an issue with swelling, bleeding or any doubt, it'll get addressed faster. It'll be there on your discharge summary also. Okay? So we'll take off these stitches. Doctor will do that now. And then you're good to leave. All right. See you. Okay, we have to make